Hi, how are you today? So my name is Victoria and I'm going to be your nurse today. I'm just going to check your patient identification. So I'm going to look at your wristband here. Can you tell me your name and your date of birth? Perfect, and it matches up. So hand hygiene. So I'm going to just tell you what the procedure is going to be today. The doctor has ordered for a Foley catheter to be inserted. You haven't peed in the last 8 hours and you stated that you have like a feeling that you have to urinate but you're not able to. So we are going to insert a Foley catheter. So it's a soft flexible tubing that enters, there goes into the urethra and up to the bladder to drain the urine, and hopefully that will alleviate the sensation of you having it. So I'm just going to begin by opening my Foley catheter tray. So I'm going to open the first one away from me, open each of the sides, and I'm going to grab the tweezers and pull up this side. I'm ensuring that it's opened away from me, and I just want to let you know that the outside border is not sterile. So I'm going to move my tray over so I have some room to work with. I'm going to put this inside my sterile field so that the edges are in so it's still sterile. I'm going to open my catheter onto my sterile field. Before that, I put my gloves on. Next, I am going to open my sterile gloves and put them on to ensure that I can touch everything within the sterile field. So I'm going to open this up. So this is considered a sterile field, and my hands are currently unsterile or non-sterile. The border of this package again will be not sterile. So I am going to hold on the outside of the glove to put my right hand in. And then let the outside go. So this hand will now be sterile. And then I'm going to take the inside of my left hand glove, put my hand into it, and I want to ensure that I don't touch my arm with my sterile glove. And let that go. And now both my hands are sterile. I'm touching the inside of the sterile field and just hold it straight up. So, to begin, I'm going to drape my patient. I am now able to touch everything because my hands are sterile. So I'm going to keep my hands on the inside to ensure I don't touch my patient's leg. For this procedure, I'm going to put my patient to go into lithotomy position, so bending their legs, or bending their knees and opening their legs. I have an extra pair of gloves, which I don't need because I have my sterile gloves on, so I'm just going to move that off the sterile field, which is now considered unsterile. I am going to open an extra thing. So I'm going to drape that over my patient and touch this, that's still sterile. So I have a urine specimen container that I do not need right now. I'm just going to move that to the other side. So I'm going to touch the inside of this tray and move it in front of my patient, which is still on the sterile field. So to begin, I will use the beta iodine to clean the area. This is the antiseptic. So it is a darkly pigmented in color, and I'm going to dump that over my cotton balls. And then just discard that in the garbage. So next I'm going to grab my tweezers from inside. And I'm going to clean the patient's perineum. So I'm going to do one stroke through the middle. Discard the outside. Discard it again. Okay, and finally discarding that. So that is now clean. I'm going to set this within the sterile field. So next I'm going to insert the catheter. I'm going to use my lubricating gel, and this will be put on the end of the catheter. For catheter sizing, I am using a size 12. Catheters are measured in Foley sizes, and that tells you about the circumference of the Foley catheter. So I can open this, and this was open into my sterile field, so I am able to touch that off. So I'm going to open that. Okay, so I am going to first check that this catheter is going to properly work. I'm going to ensure that the balloon fills up. I'm going to open my syringe. I'm using a size 12. Generally, for females and males, the average size is between a size 12 and 14 Foley catheter. And you normally use a bigger one, like between 16 and 20 for individuals that have like blood clots or hematuria that's going to be passing that may clot the side or clot the tubing, which you do not want. So today I'll be using a size 12. You always want to use it the smallest size possible to just promote comfort for the patient. Using too big of a size in a patient, that's unnecessary and that can cause discomfort. So again, I will be using a size 12 French catheter. So I'm going to insert the saline into the catheter to ensure that the balloon is going to blow up. Okay, and we can see that the balloon is blowing up and is holding its water. So I'm just gonna I'm gonna deflate the balloon. Perfect. So I'm just gonna set that there because I will be using that to anchor the balloon. So the next step, I'm gonna connect my syringe into my catheter, just so that's ready to insert. So I'm going to put the lubricating gel on the end of this. So I'm putting that on the tip. I'm going to put the Foley or the catheter in my right hand. So I'm just going to let you know that I'm going to begin the procedure. I'd like you to take a deep breath. I'm going to use my left hand to open up the area. And my left hand is considered now non-sterile. I'll be using my right hand to insert the catheter into the urethra. Okay, so I've started to see urine come back out into my container, and I'm going to push it in another few inches to ensure that the balloon is actually inside the bladder and it doesn't get blown up in the urethra, which can cause pain in the patient. Put it in another couple inches. So there, I am going to hold this with my left hand, hold the catheter in place with my left hand because I don't want the pressure to push it back out. I'm going to use the syringe to blow up the balloon. And I'm going to now disconnect it. So that is done, and we're done with that now. And I am going to ensure that the balloon is anchored in place, which it is. So I can now remove my hand. I'm going to connect the catheter bag into the catheter. So I'm going to remove the cap and put the catheter into there. So I'm just going to place the bag below the height of the waist to ensure that there's no backflow within the patient. And you can measure the urine output through that now. So hello again, it's been 36 hours and you've become more mobile, and we are going to remove the catheter to try and promote bladder control on your behalf. So I'm going to identify your patient with your bracelet again. Can you tell me your name and your birthday? Perfect, everything matches. So for this procedure, I'm actually going to use clean gloves and not sterile gloves because I'm protecting myself in this procedure and not the patient. So I'm going to put on my clean gloves. So the catheter bag is now full. I'm going to leave that and disconnect it as a unit, and then I will measure the urine output that is in the bag afterwards. So to begin the procedure, I'm going to have to, the balloon is anchored in the catheter, or the catheter is anchored in there by the balloon. So I am going to use my syringe, an empty syringe, and I am going to hook it back up and get the, to deflate the balloon. So I'm going to hook the syringe back up. And I'm noticing that the water, or the solution is coming back into the syringe. So once it is full up to my 10 milliliter cc point, I know that the balloon will be deflated, so I'm going to remove the syringe and set that aside. So I'm going to pull out the catheter in one gentle and smooth motion. I'm just going to get you to take a few deep breaths as they do this. Remove it. There. So I'm just going to put this on here, disconnect this cord from the bag, and I'm just going to throw this all out and use hand hygiene to wash my hands afterwards. I'm going to measure the amount that's in the bag into a container, a solid container, to measure the milliliters of urine output in the last catheter, to then record that in my charting. So I'm just going to drain that, and then I can throw this out as well. For some patient education and like information that you need to know from after discontinuing the catheter, the first time that you urinate might be a little bit painful, or some stinging or some burning, and that is normal. And I just want to let you know that we're going to monitor your output. If you haven't urinated within the next 6 hours, we will consider putting the catheter back in. We will use a bladder scanner to check how much urine is in your bladder, and if you do urinate, we are going to bladder scan you after to ensure that you've excreted all of the bladder in your urine. We don't want any urinary retention.